This patch contains testosterone and is used to replace hormones in men who are unable to produce enough testosterone, such as those with hypogonadism. It is absorbed through the skin and helps the body reach normal testosterone levels. Testosterone is important for developing and maintaining male sexual characteristics, as well as maintaining muscle and preventing bone loss. It is also necessary for natural sexual ability and desire. This medication should not be used by women. The daily dosage and optimal timing for using this patch will depend on the individual's specific condition, so it's important to follow the instructions provided by your healthcare provider. Before using the Androderm patch, transdermal 24 hours, it's important to read the patient information leaflet provided by your pharmacist. If you have any questions, be sure to ask your doctor or pharmacist for clarification. There are various testosterone products available for skin application, each with different amounts of testosterone and effects. It's crucial to carefully read and follow the dosing instructions for each product. Always consult your doctor or pharmacist before changing products. When applying the patch, make sure the skin is dry and clean. It can be placed on the back, abdomen, upper arms, or thighs, but avoid areas treated with topical ointments. Do not place the patch on oily or irritated skin, or on bony areas like the shoulders or hips. To use the patch, remove the protective backing and place it sticky side down on clean, dry skin as directed by your doctor, typically once nightly for 24 hours. Replace the patch with a new one after 24 hours, and apply it to a different area each day. Wait 7 days before applying a patch to the same area of skin. The patch can be worn during sex, but wait at least 3 hours after application before showering, swimming, or any contact with water. Heavy exercise or sweating may loosen the patch, so press around the edges to secure it. If it falls off, follow the instructions in the missed dose section. When discarding a patch, fold it with the adhesive side on the inside and place it in the pouch from which the new patch was taken, then dispose of it in the trash. Use this medication regularly at the same time each night to get the most benefit from it. Misuse or abuse of testosterone can lead to serious side effects, so it's important to follow the prescribed dosage and not use it more often or for longer than directed. If you experience withdrawal symptoms when stopping the drug, consult your doctor. Be sure to inform your doctor if your condition persists or worsens. When using the Androderm patch, you may experience itching, irritation, or discomfort at the application site during the first few days. Other side effects may include acne, headache, hair loss, anxiety, and changes in sexual desire. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist promptly. It is important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it is important to notify your doctor right away if you experience serious side effects, including breast pain/enlargement, swelling of the feet/ankles, weight gain, difficulty breathing, unusual weakness, trouble urinating, mental/mood changes, changes in size/shape of the testicles, stomach/abdominal pain, dark urine, yellowing of eyes/skin, or a fast/irregular heartbeat. In rare cases, males may experience a painful or prolonged erection lasting 4 or more hours. If this occurs, stop using the patch and seek medical help immediately. Burn-like reactions under the patch may also occur rarely, especially if the patch is placed on bony areas of the body. If this type of reaction occurs, it is important to notify your doctor right away. If you have diabetes, especially if you are using insulin, testosterone may decrease your blood sugar. Be prepared to treat low blood sugar while using this medication and consult your doctor if you experience symptoms such as shakiness, nervousness, rapid pulse, or sweating. In the case of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it is important to contact your doctor or pharmacist if you notice any other effects not listed above. Before using Androderm patch, transdermal 24 hours, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your healthcare provider. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have a history of male breast cancer, prostate cancer, blood clots, liver problems, heart problems, stroke, kidney problems, diabetes, high cholesterol, breathing difficulties during sleep, high blood pressure, or bone cancer. If you are scheduled to have an MRI test, it's important to let the testing personnel know that you are using this patch, as some patches may contain metals that can cause serious burns during the MRI. Your doctor can advise you on whether you need to remove the patch before the test and how to properly apply a new patch afterward. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to monitor the height of children regularly while using this medication, as it may affect their bone growth and sensitivity to its side effects. Men, especially older adults, are at a higher risk for developing enlarged prostate or prostate cancer while using this medication, so it's essential to have your risk of prostate problems checked by your doctor before starting testosterone. This medication can also affect fertility in males, so it's important to discuss this with your doctor for more details. Androderm patch, transdermal 24 hours should not be used by women. Women who are accidentally exposed to this medication may experience side effects due to testosterone. If you notice symptoms in a woman such as changes in body hair or a large increase in acne, it's important to speak to her doctor and your doctor right away. Women who are pregnant or breastfeeding should avoid contact with this medication, as it may harm an unborn or breastfeeding baby. It's crucial to consult your doctor for more details regarding this. It's important to be aware of potential drug interactions with the Androderm patch. This can affect how your medications work or increase your risk for serious side effects, so it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to inform them before starting, stopping, or changing the dosage of any medicines. Additionally, some products that may interact with this drug include blood thinners such as warfarin. It's also important to note that this medication may interfere with certain lab tests, such as thyroid function tests, possibly causing false test results. Make sure that lab personnel and all your doctors are aware of your use of this drug. If someone accidentally chews or swallows the Androderm patch, it can be harmful. If this happens, the patch should be removed. In serious cases, such as passing out or having difficulty breathing, it's important to call 911. Otherwise, contacting a poison control center right away is essential. Symptoms of overdose may include weakness on one side of the body, trouble speaking, vision problems, or confusion. It's important to be aware of these symptoms and seek help if needed. Remember, it's always better to be safe than sorry. It is important not to share this medication with others, as it is against the law. While using the Androderm patch, you may need to undergo lab and/or medical tests such as PSA, cholesterol, hemoglobin, hematocrit, testosterone blood levels, and prostate exams. It's important to keep all medical and lab appointments. Consult your doctor for more details. This medication has been prescribed specifically for your current condition, and should not be used later for another problem unless instructed to do so by your doctor. In such cases, a different medication may be necessary. If the patch falls off or if you miss a dose, apply a new patch immediately. If it is afternoon the next day and you remember that you missed a dose or if your patch fell off, do not apply a new patch. Instead, go back to your usual dosing schedule. Do not double the dose to catch up. Remember, consistency is key when using the Androderm patch, so be sure to follow your doctor's instructions closely. When you have Androderm patches, make sure to store them in their protective pouches at room temperature. Keep them away from heat, light, and moisture, and definitely not in the bathroom. Once you've used a patch, be sure to discard it properly to avoid exposing others to the drug. And as always, keep all medications out of reach of children and pets. When it's time to get rid of the patches, don't just flush them down the toilet or pour them down the drain unless specifically told to do so. Instead, follow the instructions in the How to Use section, and discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.